Hey everyone, and welcome back for another deep dive.
Yes, welcome back.
Today we're going to be looking at dental implants and teeth whitening.
That's right.
So two very common procedures in dentistry, but as we'll find out, maybe not as simple as they seem.
Yes, very true.
So we're going to be pulling from a dental materials course we found, specifically looking at the chapters on implants and teeth whitening.
Yeah, should be a good one.
So I think this will be really interesting to kind of go behind the scenes and look at all the details.
Absolutely.
So to kick things off, let's start with dental implants.
Okay, sounds good.
I think a lot of people listening probably have at least like a vague idea of what those are.
Yeah.
But can we break it down like at the most basic level? What are dental implants?
Sure. So basically, you can think of a dental implant as an artificial root for your tooth. So it's a small biocompatible post that gets surgically placed into your jawbone, and it acts as an anchor for a replacement tooth.
So it's not just like the part you see, it's like the foundation of the tooth as well.
Exactly, that's right.
Oh, that's cool.
Yeah, and that's where the biocompatible part is important. So it's typically made from titanium, which is a very strong metal, but also one that can actually integrate with the bone.
Wait, so the bone like fuses with the metal?
Exactly. It's called osseointegration.
Oh, wow.
And that's what makes these implants so strong and stable and allows them to function like natural tooth roots.
So it's like the implant's like a scaffold, and the bone just kind of grows around it and basically like makes it part of the jaw.
Exactly.
Okay.
Yeah, perfect analogy.
Wow, that's amazing.
Yeah, it's a pretty remarkable process.
So you mentioned different types of implants. Is there one standard implant or are there multiple?
Yeah, so there's actually three main types: Subperiosteal, transosteal, and endosseous.
Okay.
So Subperiosteal, those sit on top of the bone but under the gum tissue.
Okay.
They're not used as much nowadays, usually only if there's not enough bone height for other types.
Gotcha. So that's like a special case.
Exactly.
Yeah.
Yeah. And then transosteal implants, they're even less common. Those actually go through the jawbone. Sometimes used on the lower jaw where the bone density can be lower. But yeah, those are both pretty rare.
Okay. So what's the most common one then?
The one you're most likely to come across is called an endosseous implant.
Okay.
And this is the one we were just talking about that gets placed directly into the jawbone. So it's the gold standard these days.
Okay. Endosseous. Got it.
Yeah.
So let's talk about how they're actually placed. I mean, I imagine it's like a pretty intense surgery.
It is a surgical procedure, but it's actually become very routine and predictable.
Oh, okay.
So there are two main approaches. You've got the one-stage and the two-stage procedures.
Okay.
For the two-stage, we first place the implant fixture, which is the part that goes into the bone.
Okay.
And then the gum tissue is stitched closed over it and left to heal for a few months.
So it's like letting the foundation settle before you build the house.
Yeah, exactly.
Okay.
And then once it's healed and integrated with the bone, we do a second, smaller surgery to expose the implant and attach what's called a healing abutment, which is a small connector that sticks out through the gums and allows us to start the process of attaching the artificial tooth.
Okay. So 2 stages make sense. What about 1 stage?
So for one stage, those first two steps are combined into a single surgery.
Oh, okay.
So the implant fixture and the healing abutment are both placed at the same time, so you skip that second procedure.
Oh, that's interesting. So it's less surgery overall?
Exactly.
Yeah.
Yeah, and that's a good option for some patients, but it really depends on your specific situation, and your dentist will help you decide which approach is best for you.
So are there like specific criteria that make someone a good candidate for the 1 stage?
Yeah, there are definitely some factors that come into play, things like the quality and quantity of the bone, the location of the implant, and your overall health.
So it's not just like, hey, well, less surgery, let's do it.
Right, yeah. It's a decision that needs to be made carefully with your dentist.
Okay, that makes sense. So we've got the implant nice and secure in the bone, either 1 or 2 stages. And then what happens next? Like, how does the actual tooth get attached?
So that's where the restorative phase comes in.
Okay.
And it involves a few key steps. So first we take impressions of your mouth, which are basically molds to create a model for your final restoration.
Okay.
And then a dental lab will custom make your artificial tooth, which could be a crown, a bridge, or even a denture.
Oh.
And then once the restoration is ready, it gets attached to that healing abutment we talked about earlier.
Okay, so the abutment is like the connector between the implant and the crown or denture.
That's right. It's like a little middleman.
Gotcha. So it's kind of like a 3-part system. You've got the implant in the bone, the abutment as the connector, and then the crown or denture as the actual tooth you see.
Exactly. Yeah, you got it.
That's cool. But I'm wondering, like, what about people who don't have enough bone to support an implant? Like, is that just a deal breaker?
That's a really good question, and it brings us to something called bone grafting.
Okay.
So bone grafting is a procedure that's often needed when someone has lost bone, due to things like periodontal disease or injury, or sometimes even just the natural process of aging.
So if the foundation isn't strong enough, you got to reinforce it.
Exactly, yeah. You need to build up the bone to provide enough support for that implant.
Makes sense. So where does the bone for the graft come from?
It can come from a few different places.
Oh, really?
Yeah, sometimes it's taken from another part of your own body, like your hip or chin.
Oh, wow.
That's called an autograft. Or it can come from a donor, which is an allograft, or even an animal source, which is a xenograft.
Oh, interesting.
And then there are also synthetic bone graft materials called alloplasts.
Wow. So there's like a whole world of bone options.
There is, yeah. And the choice of which one to use depends on a lot of different factors.
So the dentist kind of decides what's best based on the specific situation.
Exactly.
Okay, so it sounds like bone grafting can make implants possible even when there's bone loss, but I'm guessing it also adds a level of complexity to the whole thing.
It does, yeah. But it's often worth it to ensure that implant is successful and lasts a long time.
So it's an investment. Okay, now sometimes with bone grafting, they also use something called a barrier membrane, right?
Yes, that's right.
So what is that all about?
It's basically a thin sheet of material that gets placed over the graft to protect it and help it heal properly.
So it's kind of like creating the ideal environment for the bone to regrow.
Exactly.
Yeah.
Yeah, it helps to keep everything in place and prevent other tissues from growing into the area where you want that new bone to form.
Gotcha. Okay. And then there's another procedure you sometimes hear about, especially for implants in the upper jaw, and that's a sinus lift.
Yes, that's right.
So what is that all about?
So your sinuses are those air-filled cavities in your skull, and the maxillary sinuses, which are the ones right above your upper back teeth, can sometimes be an issue for implant placement.
Okay. How so?
Well, if there's not enough bone height in that area, a sinus lift is done to create more space.
Okay.
So basically, the sinus membrane is lifted up and bone grafting material is packed into the space below it.
So it's like you're pushing the sinus up a bit and then filling in that space with bone so the implant has something solid to anchor to.
That's a great way to put it, yeah.
Wow, that's pretty amazing.
Yeah, it's a very specialized procedure, but it can be really effective in allowing people to get implants who might not have been candidates otherwise.
Okay, so I'm imagining with all these procedures, especially the bone grafting and sinus lifts, that there's a decent amount of healing time involved.
Yeah, you're right. There is a healing period, but the good news is that you're not completely toothless while you wait for everything to heal.
Oh, good.
Yeah, dentists often provide temporary restorations like dentures or bridges so you can still function normally and, maintain your appearance.
Okay, so you're not walking around with a big gap in your smile for months on end.
Exactly.
That's good to know. So during that healing process, are there specific things you need to do or avoid to make sure everything heals properly?
Yeah, definitely. So first of all, you'll have sutures, which are stitches that hold the gum tissue together. Some of them dissolve on their own, but others need to be removed after about a week.
Gotcha.
And your dentist will give you specific instructions on how to care for those sutures.
So like gentle brushing around the area, I'm assuming.
Exactly, yeah. And you'll also need to avoid certain foods that can irritate the surgical site, like crunchy or sticky things, and smoking is a big no-no.
Makes sense. No crunching, no sticking, and definitely no smoking.
Right.
Okay, and then what about pain management? I mean, I'm picturing some pretty serious discomfort after having all that work done.
Yeah, it's understandable to be concerned about pain, but most patients actually manage really well with just over-the-counter pain relievers like ibuprofen or acetaminophen.
Oh, okay.
Your dentist might prescribe something stronger if needed, but usually those over-the-counter options are enough.
So it's not like you're in agony for weeks after the surgery.
No, not at all.
Okay, that's good to know. So let's say everything's healed up. You've got your implant integrated with the bone, and you've got your beautiful new tooth. How do you care for these implants long term?
That's a great question, and it's really important because while dental implants are incredibly durable and can last a lifetime with proper care, they're not invincible.
So they're not like a set it and forget it kind of thing.
Right, exactly. They need to be cared for just like natural teeth to prevent any problems down the road.
Okay, so give us the rundown. What does proper implant care look like?
It's a two-pronged approach. You need diligent home care and regular professional cleanings.
Okay, so let's start with home care. What's involved?
Well, brushing twice a day is still essential, but you might need to use a special kind of toothbrush.
Oh, there's like an implant toothbrush.
It's not necessarily a specific toothbrush, but the technique is important. You want to be gentle around the implant, and you might need to use specialized brushes to reach certain areas.
So what kind of specialized brushes are we talking about?
So there are a few key players. There's the sulcus brush, which is a small round brush designed to clean around the implant where it meets the gum tissue.
Okay.
That area is called the sulcus, and it's particularly vulnerable to bacterial buildup, so keeping it clean is super important.
Gotcha. So sulcus brush, check. What else?
Then you have interproximal brushes, sometimes called proxy brushes, and these are tiny cone-shaped brushes with bristles that are designed to clean the spaces between your teeth, and they come in different sizes to fit different gaps.
Okay.
And for implants, they often have nylon-coated wires to prevent them from scratching the implant surface.
Oh, that's smart. So it's like a super fine cleaning tool for those tight spaces.
Exactly.
Okay. And then what about the end tuft brush? I've heard of those too.
Right, those are great for cleaning around the implant and those hard-to-reach areas in the back of your mouth.
So you basically have a whole arsenal of brushes to keep those implants clean.
Pretty much, yeah. You want to make sure you're getting every nook and cranny.
Now, what about flossing? Do you still need to floss with implants?
Yes, flossing is still absolutely essential, but again, you might need to adjust your technique.
Okay. So,
Regular floss might not be ideal for getting around the implant, so you might need to use a floss threader or dental tape, which is thicker and flatter than traditional floss.
okay, so floss threaders and dental tape added to the shopping list.
Exactly.
And then what about mouthwash? Is that helpful?
Mouthwash can be helpful, yeah, especially antibacterial ones to control bacterial growth and keep your mouth fresh, but it shouldn't replace brushing and flossing.
So it's not a magic bullet, just an extra layer of defense.
Right.
Okay, so home care is clearly crucial, but you also mentioned professional cleanings.
Yeah.
How often do you need to see the dentist for implant maintenance?
The general recommendation is every 6 months, just like with natural teeth.
Okay, so same schedule, but
Yeah.
is the cleaning process any different?
There are some key differences. Yeah. For one thing, the hygienist will use special instruments that are safe for implants.
No, because the metal ones can scratch the implant.
Exactly. So they'll use titanium or plastic instruments instead.
Oh, okay.
And they'll also be careful about the type of prophy paste they use, opting for a gentle one to avoid abrasion. Another technique that's becoming more popular for implant cleaning is air polishing. Have you heard of that?
I've heard the term, but I don't really know what it is.
So it uses a fine powder, often made from glycine, which is a natural amino acid,
Okay.
to gently and effectively remove plaque and biofilm without damaging the implant surface.
Oh, so it's like a gentler version of sandblasting.
Yeah, you could think of it that way.
Interesting.
Yeah, and during those cleanings, the hygienist will also check the implant for any signs of mobility, which could be an early indicator of a problem.
Okay, so it's not just about cleaning, it's about checking for any red flags.
That's right.
Okay, this might be a scary question, but what happens if, despite all this meticulous care, something goes wrong with the implant? Are there risks involved?
It's a valid question, and it's important to be aware of the potential risks.
Sure.
While implants do have a very high success rate, complications can occur.
Okay, like what?
One of the most common is peri-implantitis, which is basically an infection that affects the tissues surrounding the implant.
Peri-implantitis sounds serious.
It can lead to bone loss around the implant and potentially cause it to fail.
So it's kind of like gum disease, but for implants.
Yeah, that's a good analogy.
Okay, so what are the warning signs that something's up?
So look out for things like redness, swelling, or bleeding around the implant, a bad taste in your mouth, or even loosening of the implant itself.
Got it. So any of those symptoms, and it's time to see the dentist, ASAP.
Absolutely.
Okay, well, this is all very good information to know. I think a lot of people probably assume implants are like a one-time fix, but it's clear that ongoing care is really important for their long-term success.
That's right. It's an investment in your oral health, and it's worth taking the time to care for them properly.
Absolutely.
Yeah.
So we've covered a lot of ground on implants.
Yeah.
I think it's time to switch gears and talk about teeth whitening.
Sounds good to me.
Let's face it, everyone wants a brighter smile. But before we get into the how-tos, let's talk about the why do teeth get stained in the first place?
Okay, that's a great question. And it's actually a bit more complicated than you might think. So tooth discoloration can be broken down into two main categories: extrinsic stains and intrinsic stains.
Okay, so what's the difference?
Extrinsic stains are on the surface of the tooth.
Okay,
It's the enamel that gets stained, and it's usually from things we eat and drink.
so like coffee and tea.
Exactly. Yeah, coffee, tea, red wine.
Makes sense.
Even some fruits like berries and sauces like soy sauce or curry can stain your teeth. And then, of course, there's tobacco.
Yeah, right? Smoking and chewing tobacco.
Yeah, those can leave some pretty stubborn stains behind.
So it's all the good stuff, basically.
Yeah, pretty much.
So we got to watch out for all the delicious things in life.
Right.
Now, what about intrinsic stains? Those sound a little more mysterious.
Yeah, so intrinsic stains are a little trickier because they come from inside the tooth.
Okay.
So instead of just staining the enamel, they actually affect the dentin, which is the layer underneath the enamel.
I see.
And these can be caused by a bunch of different things.
Okay, like what?
Well, some medications can cause intrinsic staining.
Really? I had no idea.
Yeah, it's not super common, but it can happen.
So what kind of medications are we talking about?
One of the most well-known is tetracycline.
Okay.
It's an antibiotic, and if you take it when you're a kid, while your teeth are still developing, it can cause this grayish or brownish discoloration.
Oh, wow.
Yeah, and there are other medications too, like some antihistamines, antipsychotics, even some high blood pressure meds can affect tooth color.
So it's worth checking with your doctor or dentist if you're taking any of those medications long term.
Yeah, definitely. It's always good to be aware of the potential side effects.
Okay, so medications got it. What else?
Excessive fluoride exposure, especially during childhood, can also cause intrinsic staining.
Okay, so too much of a good thing can be bad,
Exactly.
right? And what does that kind of staining look like?
It's usually white spots or streaks on the teeth.
Okay, so it's different from the yellowish stains from coffee and stuff.
Right, it's actually kind of the opposite. You get these white marks instead of dark stains.
Interesting. Okay, what else?
And then trauma to a tooth can also cause discoloration.
Like if you get hit in the mouth or something.
Yeah, exactly. Or even if you fall and damage a tooth when you're younger, it can disrupt the enamel formation and lead to discoloration later on.
Wow. So many things can affect tooth color. I never realized.
Yeah, it's pretty amazing when you think about it.
Okay, so let's say we've got these stains, whether they're extrinsic, intrinsic, or a combo of both. What's the secret to getting rid of them and getting that nice bright smile?
That's where teeth whitening comes in.
Okay.
It's a process that uses special agents, usually containing peroxide, to break down the stain molecules and lighten the color of the teeth.
So it's basically bleaching your teeth.
Yeah, kind of, but it's a bit more controlled than just using regular bleach.
Okay, that makes sense. So what are the most common whitening agents?
The two big ones are hydrogen peroxide and carbamide peroxide.
Okay, and how do those work?
They both release oxygen ions that penetrate the enamel and dentin. And those oxygen ions break down the stain molecules into smaller, less pigmented compounds.
Oh, so they're basically oxidizing the stains away.
Exactly.
Chemistry in action.
Right.
Very cool. So let's talk methods. I know there are different ways to whiten your teeth, from those in-office treatments to the at-home kits you see everywhere. What's the difference and which one is best?
That's a question I get a lot, and the answer is it depends.
Of course.
So in-office whitening, sometimes called power whitening, typically uses a higher concentration of hydrogen peroxide, usually between 15 and 40%.
Wow, that's pretty strong.
Yeah, it is. And the gel is applied to your teeth and often activated by a special light or laser to speed up the process.
With lasers on my teeth, that sounds a little intense.
I know it sounds kind of scary, but it's totally safe and very effective when done by a trained professional.
Okay, good to know. So what does the laser actually do?
It acts as a catalyst to speed up the chemical reaction of the peroxide, so it helps to boost its whitening power.
So it's not like it's zapping the stains away or anything.
No, not at all. It's more about making the peroxide work more efficiently.
Okay, so what are the main advantages of in-office whitening?
The biggest one is speed,
Okay.
because you're using a higher concentration of peroxide, and that light or laser activation, you can get really dramatic results in just one visit, often in an hour or less.
Wow, so if you need a quick fix, in-office is the way to go.
Yeah, pretty much. But of course, it's also the most expensive option.
Yeah, I bet. So what about the at-home kits? How do those compare?
At-home kits are a good option if you're looking for something more affordable and convenient.
Okay.
They typically use a lower concentration of peroxide, usually between 3 and 20%.
Okay, so it's gentler on your teeth.
Exactly. And you use custom-fitted trays to hold the whitening gel against your teeth for a certain amount of time, usually 30 minutes to a couple of hours per day.
So it's a slower process, but you have more control over it.
Right.
And you can do it in the comfort of your own home.
Exactly.
Now, you mentioned custom-fitted trays. Why are those so important?
Well, first of all, they help to keep the whitening gel in contact with your teeth, so it's more effective.
Okay.
And it also prevents the gel from getting on your gums, which can cause irritation.
That makes sense.
And secondly, custom trays help to distribute the gel evenly, so you get a more consistent whitening result.
So you don't end up with like blotchy or uneven teeth.
Exactly.
Okay, so custom fit equals better results and less irritation.
Yeah.
Got it. Now, what about those over-the-counter whitening products you see everywhere, like the strips and the toothpastes? Are those worth trying?
They can be helpful, yeah, especially for maintaining a brighter smile or if you just have some very mild staining,
Okay.
but they're not going to be as powerful as professional treatments.
Why not?
Well, they use much lower concentrations of peroxide, usually less than 10%.
Okay, so they're not as strong.
Right, and they don't always have those custom-fitted trays, so you might not get even whitening, and you could even irritate your gums.
So buyer beware.
Exactly. Always talk to your dentist before trying any whitening product, especially if you have sensitive teeth or gums.
Good advice. So speaking of sensitivity, that's one of the most common side effects of teeth whitening, right?
It is, yeah.
So what causes that and what can be done about it?
The peroxide in those whitening products can temporarily dehydrate your teeth,
Okay.
and that makes them more sensitive to cold, hot, or even sweet foods and drinks.
So it's like that brain freeze feeling, but in your teeth.
Yeah, kind of. Not fun. But the good news is that it's usually mild and temporary, just a day or two.
Okay, so it's not a long-term thing.
Not usually. And there are things you can do to minimize the sensitivity.
Oh, like what?
Well, you can use a toothpaste designed for sensitive teeth
Okay.
and try to avoid very hot or cold foods and drinks during the whitening process.
Makes sense.
And your dentist might recommend using a desensitizing gel before or after whitening.
So there are options if you're worried about sensitivity.
Yeah, definitely.
Now, what about those really stubborn stains that just don't seem to go away with whitening? Is there anything else you could do?
There is one technique that can be helpful for surface discolorations that don't respond well to bleaching. It's called enamel microabrasion.
Enamel microabrasion. That sounds kind of scary, like you're sanding down your teeth.
It's a little bit like that, yeah.
Okay.
But it's a very controlled procedure, and it uses a mildly abrasive paste and a rotating instrument to remove a thin layer of enamel.
So it's basically polishing away the stains.
Exactly.
But is that I mean, you're actually removing enamel, right?
It is safe when it's done by a trained professional,
Okay.
but it's important to control how much enamel is removed. Too much can weaken the tooth.
So it's not something you'd want to try at home.
Definitely not.
Okay, so we've talked about all these different methods, but who is a good candidate for teeth whitening in the first place?
That's a great question, and it's important to have a conversation with your dentist to figure out if whitening is right for you.
Okay, so what are some of the factors that make someone a good candidate?
Well, first of all, the type of stain, as we talked about, extrinsic stains, are generally easier to whiten than intrinsic stains.
Makes sense.
So if your discoloration is mostly from coffee, tea, or tobacco, you're more likely to see good results with whitening.
So there's hope for us coffee lovers.
Absolutely.
Okay. But if the stains are intrinsic, like from medications or fluorosis, whitening might not be as effective.
Right. In those cases, your dentist might recommend other treatments like veneers or bonding.
Okay, so it's not a one-size-fits-all solution.
Exactly.
What else does the dentist consider?
The overall health of your teeth and gums is super important.
Okay.
If you have any active decay, gum disease, or other issues, those need to be addressed before you start whitening.
So you need a clean bill of health from your dentist.
Pretty much, yeah.
Makes sense. What else?
And they'll also look at the condition of any existing restorations you have, like fillings or crowns.
Okay, why is that important?
Well, whitening agents only work on natural tooth structure, so your fillings and crowns won't change color.
Oh, I see.
So if you have a lot of visible restorations, whitening might make your teeth look uneven.
So you might need to replace those restorations after whitening if you want everything to match.
Yeah, that's a possibility.
Interesting. Okay, so it's not just about wanting a whiter smile. You have to have the right foundation for it.
Right.
Okay, so let's talk about results. I have a question that might sound a bit vain, but I'm sure a lot of people are wondering, how white can you actually go?
That's a great question, and the answer is, it depends.
Of course it depends.
There are a lot of factors that come into play, like your natural tooth color, the type and severity of the stains, the whitening method you choose, and even your genetics.
Genetics, really?
Yeah, some people are just naturally predisposed to having whiter teeth.
Interesting. So you can't always get those super bright Hollywood white teeth.
Right, and it's important to have realistic expectations.
Yeah?
Your dentist can help you understand what's achievable and guide you towards a shade that looks natural and complements your overall appearance.
So it's about enhancing your natural beauty, not creating some artificial look.
Exactly.
Okay, that makes sense. Now, before we wrap up this deep dive into whitening, I have one last question. Are there any long-term risks associated with teeth whitening?
That's a good question, and it's definitely something to consider. While teeth whitening is generally considered safe when done correctly, there are a few potential long-term risks to be aware of.
Okay, like what?
One is enamel erosion.
Okay.
If you're constantly using whitening products, especially those with high concentrations of peroxide or abrasive ingredients, you could wear down your enamel over time.
Oh, so like anything moderation is key.
Exactly.
Okay, what else?
Another risk is damage to your gums.
Okay.
Some whitening agents can be irritating to the gums, and if you use them too often or improperly, you can end up with inflammation or even gum recession.
So you have to be careful about protecting your gums.
Definitely.
Okay, and then what about oral cancer? I've heard that teeth whitening might increase your risk.
So there's no conclusive evidence that teeth whitening directly causes oral cancer.
Okay. But some studies suggest that excessive use of peroxide-based products might promote the growth of existing cancerous lesions.
So it's something to be mindful of.
Yeah, it's always best to err on the side of caution and talk to your dentist about any concerns you have.
Good advice. So basically, weigh the pros and cons, discuss any concerns with your dentist, and proceed with caution.
Exactly.
And prioritize the long-term health of your teeth and gums.
Absolutely.
So it sounds like with both implants and whitening, it's really important to have a good relationship with your dentist.
Absolutely. It's not a one-size-fits-all approach.
Yeah.
What works for one person might not be the best option for another, and there are so many factors to consider.
Right.
Your dentist can help you make informed decisions about your oral health and guide you towards the best possible outcome.
Yeah, they're definitely the experts.
Exactly.
I feel like we've covered a huge amount of info on implants and whitening today. Anything else we missed?
I think we hit all the major points.
Yeah, we talked about the different types of implants, the materials used.
Yeah.
The surgical procedures involved,
Right.
the importance of bone grafting and post-surgical care, and then, of course, all the different methods of teeth whitening, in office, at home, over-the-counter options.
Yeah. And we talked about the risks and side effects and really stressed the importance of talking to your dentist.
Yeah, absolutely. I think this deep dive has been super informative.
Me too.
It's amazing how much goes into these procedures that you don't really think about.
Yeah, it's easy to take them for granted until you really start digging into the details.
Right. So what's the biggest takeaway you hope our listeners get from all of this?
I hope they realize that both dental implants and teeth whitening can be great options for improving your oral health and your smile.
Yeah.
But it's so important to do your research and talk to your dentist to figure out what's best for your individual situation.
Exactly. It's all about personalized care.
Absolutely.
So before we sign off, any final thoughts or questions for our listeners?
I think the best thing listeners can do now is think about what questions they have for their own dental professional.
That's a good point. Now that you've heard all this info, what are you curious about?
Exactly, because every situation is unique.
Yeah.
And there might be things that are specific to your own oral health that you want to discuss with your dentist.
Right. And your dentist is really your best resource for all things teeth related.
Couldn't agree more.
So keep asking those questions.
Yeah, stay curious.
And we'll see you next time for another deep dive.
See you then.
Bye, everyone.